Hi there, I'm Dr. Johnson. I'm a radiologist. Thank you for tuning in. I wanted to expand on my prior video on coronavirus and CT chest findings and how CT chest is a lot more sensitive than the swab test itself. The swab test is very specific, so if you get a positive swab test, you more than likely have the coronavirus. However, the sensitivity is as low as 60%, which means there are many times where you can have a negative swab test. 40% of the time you may still have coronavirus, so you may need to have numerous swab tests in order to see if you really have the virus. So there's a lot of false negatives with the swab test. That's why I'm really excited to share my CT findings on coronavirus itself. Before I go on to show you the CT findings, what coronavirus looks like in the lungs, it's very important to discuss the symptoms of the disease and the timing of the symptoms in order to see what it looks like in the lungs at certain periods of time. So the main symptoms are fever up to 85% of the time, cough up to 65% of the time, and fatigue up to 45 to 50% of the time. In a lesser amount of time, there is a little bit of productive sputum, they call it. Even though it's a dry cough, you can have sputum up to 30 to 35% of the time. Then there's milder symptoms, which you can have body aches, joint aches, you can have headaches, diarrhea, nausea, and vomiting, but this is only in 10 to 15% of the cases. So let's say you have these symptoms and you're unsure if you 100% have coronavirus. Let's say you have a fever, maybe it's not really high grade, or you have a cough and you're just uncertain and you can't get the swab test. So let's say you start having the symptoms today. Well, this is day 0 to 1. So usually I recommend not getting any chest study up until you wait at least 4 days, because 0 to 4 days is the early disease phase. And at that time you may have a negative chest x-ray and maybe nothing that you really see on CT. Then if you wait from 4 days to around 8 days, that's when you start seeing possibility of chest findings, but really you see more so in the CT chest. They're called ground glass opacity, which I'm going to describe in detail. And then from 8 to 13 days, you see even more findings in the lungs. Now, after 14 days, you see these fibrotic changes in the lungs, which means it's resolving, but you may not see complete resolution of the CT findings until maybe greater than 1 month. So that's kind of an interesting point, because if you're still seeing changes in the lungs and you feel better, does this mean that you're still carrying the disease? And that's still unknown, and that's something that might be cool to take a look at and find out more regarding this issue. So this is one example of a COVID-19 positive patient. Now these white things at the bases of the lungs here, that's the stuff I've been calling ground glass opacities. Now what is ground glass opacity? Is this found in many things? Well, the truth is it's very nonspecific. In general, this is found in infections, chronic interstitial disease, and what we call acute alveolar disease. Infections can be related to pneumonia, such as viral pneumonia, herpes simplex, CMV, RSV, which you can see in kids, coronavirus, and SARS. Then you can have chronic interstitial disease, and you can find this in things called interstitial pneumonias, and then alveolar disease, which you can see in edema, such as pulmonary edema and heart failure or hemorrhage in the lungs. That's why it's important to describe the pattern of these white things in the lungs, which are called ground glass opacities, because the pattern and distribution in the lungs really shows why it's coronavirus versus the other disease. Before I move on to show you different findings on the CT chest, I just wanted to start with basics. So this is the lungs themselves, and these are bronchi that look like trees which are branching, and at the ends of them there's these little balls. These are the alveoli. So when you have pneumonia or things that get stuck in the alveoli, they call it, it's the distalmost aspects or the furthest point outside of the lungs, and they travel through these bronchi or little airway passages. And this obviously is the main airway passage, the trachea here. Do you see how these whitish things, which we call ground glass opacities, are at the edges of the lungs? This is called the periphery. That's what we see in coronavirus. There are many other diseases which show these ground glass opacities, but they're in the center and don't touch the edges. So that's how we can differentiate. This is another example of coronavirus in the edges of the lungs. And here is just another example of it touching the edges of the lungs. I'm showing you a lot of examples so you can tell the difference when you see something else. So this is not coronavirus. See how this doesn't touch the edges of the lungs? So this is acute alveolar hemorrhage. Now this is a nodule that has some ground glass opacity or haziness. This is more solid and very solid. This is lung cancer. So see the stages. When we talk about coronavirus, we talk about this ground glass opacity or haziness. If it's something really solid like that, it tends not to be coronavirus. I don't know if this is hard to see or not, but this is typical coronavirus. These ground glass opacities are touching the edges of the lung, and they're greatest at the lower lung bases, lower down. So what exactly is the take-home points for coronavirus? 1, 86% show these ground glass opacities. 2, 64% of them show mixed ground glass opacities with consolidation, so it looks like this with a little more density. And then 87% of them are at the edges, 82% of them are bilateral, and 54% of them show lower lobe predominance. So basically, if you see this, it's touching the edges, it's in the lower lungs, and it's bilateral. It's a very high likelihood that it's coronavirus until proven otherwise. Okay, so that was a glimpse on what it looks like in the lungs. I know there's so much anxiety about coronavirus. Do I have it? Do I not? I have a fever, it's not high grade. I have a cough, but it's not that bad. I don't have stuff coming up, or I do have stuff coming up. I have the chills, I have a sore throat, I have a runny nose, I have body aches. And if you're scared to go ahead and get that big swab stuck up your nose and pierces, it feels like it's piercing into your brain, much easier thing would be to get an imaging study, either chest x-ray or CT chest. And take-home points are, if you don't have symptoms, yes, you can likely find something on CT scan about 54% of the time, but it's best to wait after 4 to 5 days of the onset of your symptoms to confirm you have it by imaging. So at that point earlier on, you can find these ground glass opacities that we talked about, those whitish things in the lungs. They have a specific pattern. And then if you wait a little longer, up to 13 days, you can have more consolidation in those areas. But then after 13 days, it becomes fibrotic or scarring in the lungs, and then that means it's resolving. That could take up to over a month having this scarring. So it's unclear at that point if you can still transmit it or not. Currently from the studies that were shown. Thank you so much for listening to my segment on coronavirus. I hope this helps alleviate some anxiety and know when to get tested and how to get tested. And radiology is cool because it deals with all segments of the body, all body parts. So I look forward to keeping you updated every week on something new. And if you have any questions or you want second opinions on your imaging, please email me at theprescriptionis@gmail.com. Thank you so much and stay safe out there. Bye-bye.